Why do I believe in this community? Oh, I think it's a great community for raising kids. It's a place for family.
They're nice people, they're hardworking, they're good folks, and I think it's a pleasant place to live.
I like this area. It's a small town, it's quiet, it's comfortable.
When I came to Williamsport, I came because I wanted to be in a community. Grew up in a small town in Virginia, so that's why I've stayed. I mean, I just flat out like it here.
I think the people here are incredible. Everybody pitches in to help whenever there's a need. It's a very generous community with a lot of giving people.
Williamsport, Pennsylvania is a unique community. Aside from being home to many deeply caring and generous people, it hosts a major medical facility, Susquehanna Health, the area's largest employer. Susquehanna Health transcends its obvious role as an economic driver in the community. Perhaps it's because of its long history as a faith-based organization. Or maybe it's just that Susquehanna Health is a true reflection of the community it serves.
I think we've shown the community that we care about them. They come here because they really want to come here. They feel that they're understood, they're cared for, they're cared about.
Susquehanna Health puts patients and community first, no matter what. We strive to provide high-quality, patient-focused, family-centered care, always. That's why we've embarked on an ambitious effort to create a new leading-edge health system for today and for generations to come. All told, we'll be investing some $250 million in upgrades and enhancements to all 3 campuses of Susquehanna Health. When the project is complete, we'll all benefit from an exceptionally designed healthcare system dedicated to both medical excellence and the human touch.
We had a dream, we had a vision, and we've exceeded it. We've outgrown a facility that is an average of 50 years old.
I think it's a miracle that we're able to deliver the kind of service we deliver out of this plant because it's really not suitable at all to healthcare as it is today.
The quality of the staff here is the best in the business. It is really second to none. The quality of the facilities here are among the worst 10 or 15% in the state of Pennsylvania.
So we're really limited in terms of how modern our facilities are, how they look. They might be clean, but they don't look clean because they're old.
I don't see this being a Williamsport issue. This is bigger than that. It's north central Pennsylvania and encompasses a wide area. What I would see 5-10 years down the road is a medical center that becomes a focal point for all those regions.
Individuals that we've been interviewing say, I'm interviewing someplace else where it's new and shiny, and if everything else is equal, that's where I'm going to go.
So if we don't have the facilities and the technology, they're not going to want to come here.
In planning our modernization project, we considered relocating our facilities outside the city. We listened carefully to community leaders and patients. It became clear that Williamsport and its people depend on Susquehanna Health for health care, but much more. Good jobs, economic development, and vibrancy of the city. The decision to stay in town and reinvest in existing facilities, while more costly, was the right thing to do. Sharing a hospital room with a stranger can be uncomfortable, nor are semi-private rooms the optimal setting for care. That's why we're building a new patient tower with all single-occupancy rooms. The benefits? More comfort and privacy, reduced risk of infection, and greater ability of staff to care for patients.
At a time when you're vulnerable, you don't feel like meeting new people and making new friends and being chatty. You want to be with your friends and your family that are close to you.
Right now, most of our patients are here and they're in a room with another family and another patient. And for obvious reasons, private rooms are important when it comes to the spread of infection.
Private rooms are much more amenable to taking appropriate precautions to prevent transmission of infection. and it will be much, much better. In fact, it would be hard for me to imagine anyone that was building a new hospital that wasn't building just private rooms.
And I think there are a lot of other things that these private rooms are going to offer the patient. There's going to be more control of the temperature in their room. There's going to be more space for the family. Just the amount of equipment doesn't allow for any room for your family members.
I mean, the expectations for privacy and confidentiality now are much greater than they have been, say, 10 or 15 years ago. When I go see a new patient in the hospital to evaluate them, and I'm trying to get a complete history, it really is a problem every time I see a new patient, because there are questions that I really need to ask them in order to get a complete history that are just not appropriately asked with someone else in the room next door.
There's an awful lot that goes on between patient and caregiver that's private and should be private and not necessarily available to whoever's in the next bed behind a curtain with their family or whoever.
It's crucial for us to upgrade our facilities in order to be able to do the sort of things that we want to be able to do over the next 25 to 50 years.
Cardiac care today is driven by technology. Many life-saving procedures can be performed outside the operating room. As a result, modern treatment room design allows for an easy transition from non-invasive procedures to surgery. Susquehanna Health's Heart and Vascular Institute will be expanded and renovated to incorporate new technology and offer patients even more advanced care.
In cardiology, one needs technical people, one needs a myriad of people of various skill sets in order to make things happen. And those folks are here. On the other hand, the facilities in which we work are right old.
The fact that our operating rooms, where we should be providing the most state-of-the-art support, were in fact designed back in the 60s, and the exponential change in technology that we've seen since then is inadequately housed.
Also, many procedures now are not happening in the OR. They're happening outside of the OR in procedural areas like the cardiac cath labs, the interventional vascular labs. It's time for us to build new rooms to support that equipment.
Sometimes the rooms get to the point where they're tight. We have a lot of equipment. With someone who comes back after open heart surgery, there's a ventilator, there's the bed, there's 50 million IV poles and pumps sometimes.
And the reason we're increasing the size of the rooms have everything to do with the kind of care we offer and want to continue to offer. And that's patient-focused, family-centered care. And in order to do that, our rooms will be large enough to allow for a family area in all of our patient private rooms, so that families will have the option to stay as much as possible based on the patient condition and interact with that care.
It's extremely important for Susquehanna Health to be as much on the cutting edge of the highest quality medical care as it can be, because we just kind of owe that to the folks with whom we live.
It's not good when we're completely full and there's multiple ambulances coming in with sick patients that need a room right away. There's just not enough space to do work, especially when you need to move quick.
The Susquehanna Health Emergency Department is committed to caring for any person, regardless of circumstances or financial status. But the ED is overcrowded. In a space designed in 1973 for 35,000 patient visits per year, we are currently serving nearly 60,000 patients. By 2012, we expect 70,000 people or more coming to our emergency department. Changing technology, small treatment rooms, and a space that isn't configured to handle such high patient volume means that our emergency department has achieved all it can. The solution? A modernized and expanded emergency department that offers private treatment rooms, new technologies, and decreased wait times.
We're going to double the size of our emergency services, and we're one of the largest emergency departments in the state. And right now, we can't handle the capacity of patients that we see.
The fact that we don't have the capacity to provide all the services for patients seeking care in our emergency rooms, that's very disconcerting to me.
Children are always scared, and it's hard for them. There's so much noise because all the booths are separated by a curtain. So, you know, if the child's laying there as a patient and next door there's
say, a cardiac arrest, you know, there's so much going on that child they always will cry. You will hear them crying because it's scary, it's noisy.
Patients, I think, deserve a place to be served that provides a sense of safety, a sense of security, and a sense of compassion in terms of the way the building itself actually works. Staff deserve the opportunity to work in a place that gives them confidence, that it provides an efficient way of caring for patients.
If we have more space and more privacy and more rooms, I think we can see patients more efficiently, see them more privately, and see them more effectively.
The staff is amazing. We're a good team.
You know, and you've got a really good group of people here who, try their best and give their darndest every day.
I don't think there's a word in the dictionary that could provide you with more of a shock, with more pain, with more concern, with anger, with everything. There's just nothing, when someone finally tells you, and I remember the day I was told, it's overwhelming.
It's a tough diagnosis, and when people hear the word cancer, it's a very anxiety-producing word. Most people assume when they get cancer, they assume that's it, they're going to die.
There is nothing, if you haven't experienced chemo, to sit in that chemo chair with your arm out and they put the chemo into your bloodstream and you feel that cold fluid going through your veins and you think, my God, what is happening to me?
Dealing with cancer is tough for both patients and families and our caregivers. To better serve our patients, the Susquehanna Cancer Center is being thoroughly modernized. The emphasis will be on care and comfort, but more. We're creating an environment for enhanced healing.
The Cancer Treatment Center is going to be expanding from 11,000 square feet in the basement of a building. We're going to be expanding to 33,000 square feet, where the chemotherapy patients are going to be taken up on the first floor, where there's going to be a lot of window and brightness and hopefully some cheer.
We've done everything from bring in sample furniture and let the patients try it out and actually pick the furniture. They've decided what chemotherapy chair they wanted. What do you want? What would make this more homey for you?
An important patient and staff amenity will be our new healing garden, with views and access from the treatment areas. Elements of nature and the local area are being incorporated into the design.
Technology is essential for what we do every day in treating cancer, and technology changes so fast. The new center will house a new linear accelerator.
The new machine that we're going to be getting is going to allow us to directly image the patient in the treatment position every day before they're treated. So the accuracy is going to go up quite a bit.
We have to build a vault in order to house that technology, and that's about 7 feet of concrete on all 4 sides. So it's a massive undertaking. It's about 2,000 square feet just to put this piece of machinery in. It's a huge undertaking for us. So in order to make sure that we're offering the best treatment, that we're offering patients the most that we can, so that we're ensuring that our loved ones and their families don't have to travel outside the region for their cancer care, the community needs to wrap their arms around this and help support it.
I very strongly believe that when you're about to fall, 2 things can happen. Either somebody will hold you or you learn to fly. And here, all the staff at the Cancer Center held me, and then eventually they taught me how to fly.
Our capital campaign is ambitious, but consistent with our mission, our ability to deliver hope, health, and healing. It's about people whose lives we touch every day, about caregivers who deserve better tools, about a community that deserves leading-edge health care for generations to come.
Hey, you couldn't find a more worthy organization to donate money to, because it's going to help a lot of people.
The single most compelling reason for a person to donate to this campaign is that they can make a difference in the life of each human being in north central Pennsylvania.
I think sometimes people have the misconception that, if I can't give thousands of dollars, they're not interested in my donation. But that's not true. A lot of small donations make a big difference.
Everybody feels they've got a brick, a piece of this building, something that they've contributed, no matter how small or how big it is, whatever they can feel they can give.
We're defining healthcare in this community for the next 50 to 75 years. And that says something to be a part and contribute to something that I think is that monumental for the community.
This is an initiative that we need to do. We don't have any choice in it. We have to rally people behind this. We're going to raise the money, and we'll have a first-class facility when we're done.
Susquehanna Health. Count on us for life.